Cataracts is a condition that can blur your vision and affect your daily living. We're joined by Dr. McKay from Bennett and Bloom Eye Centers. We've been talking about this all month long, so thank you so much for spending some time with us today.
Thank you for inviting me. I'm happy to be here.
So how do cataracts actually progress if left untreated, and what are some of the risks of delaying that treatment?
Well, one of the most important things to understand is that the rate at which a cataract progresses is very slow. And so what you see often is that patients really don't even know that they have a problem until the problem becomes so severe that they have trouble driving or trouble reading their medicine bottles or just normal everyday activities. You know, there's plenty of literature out there that suggests that there is an increased risk of falls and increased risk of other ailments where the patient might trip and fall and break their hip, or they might injure themselves while they're driving or doing something that they might not even think that it has to do with their vision. But in fact, it's just because they didn't see well enough to do it. Now, we're blessed in Western civilization where cataracts really don't get to the point where physical damage occurs into the eye from leaving in. And so I get asked that question a lot. Well, okay, you say I have cataracts, I don't want to do surgery. Is there any risk in waiting for the surgery? As long as the person is able to do their day-to-day activities, there's not a tremendous amount of risk in waiting for the surgery, but we do know that systemic-wise, there is an increased risk that sometimes they might have other ailments that their vision, if they would have seen better, would have been better.
And oftentimes you see this happen in older people, but do we see any of this in younger people, or is it strictly age-related?
Well, obviously the most common scenario is in the elderly population. The average age of cataract surgery in the United States is about 70, 72, to give people a perspective. But we have a very large diabetic population in Kentucky, as I'm sure you're aware, and diabetes is a significant cause of early cataracts. Trauma can cause cataracts. Other eye surgeries can cause cataracts. You can develop congenital cataracts. So some children are born with cataracts, or some people develop cataracts earlier in life. So while the majority is age-related, we do certainly see a number of ones that show up earlier than what they would have expected.
Okay, that's really good to know. And that's why eye exams are so important. So why should people make that a routine to get their eyes checked to catch this earlier rather than later?
Well, for the exact same reason that sometimes the changes are occurring so slowly that they don't even know that they're there. My favorite comment when you walk in and you say, "Oh, Miss Jones, I see that you're not seeing well in the right eye. When did that happen?" And they look at you and they say, "When I was in your waiting room and I just went like this for the first time," like they had no idea that their vision in the right eye had been blurry for 6 months. And so the changes can occur so gradually that you don't even realize that they're occurring, and having a formal eye exam with one of your eye care professionals is the easiest way to identify not only cataracts, but a plethora of other major medical concerns that we might be able to detect early on with an eye exam.
Oh, absolutely. And so when it gets to that point of surgery, how accessible is cataract surgery today, and what are the benefits of getting that all done?
First and foremost, cataract surgery is the most commonly performed operation in the United States. Don't quote me, but I think it's somewhere between 4 and 5 million surgeries that they do per year. On average, a cataract surgery takes about 8 to 10 minutes to do, and you're there at the surgery center for a couple hours waiting pre-op and post-op to make sure that you're comfortable. But the accessibility of cataract surgery continues to get better with the advantage of surgery centers in addition to hospitals, but we don't have to necessarily take patients to the hospitals. A lot of times we can do it in an outpatient facility, which provides a very comfortable, convenient, streamlined process from start to finish, where it's more of an enjoyable experience than maybe what they had anticipated. And the access to care continues to get better with the healthcare providers that we have in the state of Kentucky. Bennett and Bloom is just an example of that, where we have multiple offices, we have multiple locations in different states, we have different surgery centers, we have offices that are enabled to see you for a cataract evaluation and then schedule surgery very quickly later on that week, whereas we have other offices where we can do surgery and then we can see you in the office in case you're traveling distance-wise to go back to home, so that way you don't have to come back for a post-op, in 3 days. Or we're also able to work with your regular eye care provider to help with some of the co-management and help seeing them. So let's say you are traveling 2-3 hours for the surgery, one of the advantages that we have is we work with your primary care eye doctor, say who lives closer to where you live, so that you don't necessarily have to drive all the way back up to see us for the next day, provided everything is, of course, behaving itself like it's supposed to.
Really good to know. Well, thank you so much for taking the time to answer all of these questions. I know our viewers are very interested in this. So if you want to learn more, just go over to eyecenters.com.